Welcome to today's interview with Professor Irene Leigh from the University of Dundee, where she is the Vice Principal. Professor Leigh joins us today as a doctor, a scientist, a role model, and a leader in all of these areas. Professor Leigh, thank you very much for joining us today. I'm going to start with my usual first question, which is to ask you to tell us why you became a doctor.
Well, I can't really remember that point because it was very early. As soon as I went to secondary school, in fact, I was interested in being a doctor, and I was determined to do that throughout my school career. So I don't think I can identify a trigger that triggered my interest. I don't come from a medical family, and there were no medical contexts in the environment in which I was brought up. So it was a bizarre decision, in fact, but it worked for me.
And could you tell us a little bit about how your career developed, how you became a dermatologist?
Well, I actually went into dermatology straight after my house jobs, and it was really a position as a residential SHO to study for membership. But that year exposed me to a very wide range of people in dermatology and a wide range of diseases, and the diagnostic and clinical skills appealed to me very much as a specialty. And then I went back into medicine to get my membership and subsequently specialised in dermatology.
What do you think were the main challenges that you faced over the years?
Well, I think the main challenge was early on in my career was the decision to stay in full-time hospital practice, because I was one of 8 women medical students in my year, which was 10% of the year. And it was very unusual for women to stay in hospital medicine. And I was told that at a whole series of interviews, in fact. But I made the decision that I would have to work full-time and stay in hospital medicine, even with a young family, if I wanted to stay as a hospital consultant. And that was not an ill-considered decision. In fact, while I was waiting to go to Tanzania as a lecturer in medicine, I did a traineeship in general practice, which seemed to me to be the sensible thing to do. And I just decided that it wasn't for me. I didn't find it challenging in the way that I found diagnostic specialist, a diagnostic specialty with a lot of potential for other activities. So I made a positive decision not to go into general practice. It was based on experience rather than some sort of hypothesis. And after that, I stayed full-time in hospital practice.
And you mentioned going to Tanzania. How did that come about?
Well, that was partly for political reasons. We were very interested in what was developing in Southern Africa. It was also an opportunity to go as a lecturer in medicine with my husband, who was also a physician, with a group of like-minded individuals to work in Tanzania. At that stage, that was also recognised for general professional training, so that it gave us a huge amount of clinical experience, which was very fascinating.
What do you think are the qualities that make a leader in medicine and science?
I think it's a desire to shape what's happening, probably. I actually went into a leadership role quite late. I had already spent a lot of time establishing my research laboratory, my research group, until it was a recognised international research centre. And I hadn't really considered becoming a research dean or as a similar position. But when the Barts and London merger took place, it was clear that there was a need for somebody to help shape the research agenda. And I found that a challenge. I hadn't had any leadership training except for developing and running my own group, which I ran on a rather collegial basis rather than a hierarchical basis. So I had already had some experience of management on a relatively small scale. And so I learned how to become a dean by doing the job during very challenging times. And having had that experience of being a research dean, I then wished to be able to influence the course of the university in a more substantive way. And so I became the vice principal at the University of Dundee, which allowed me again to shape and move the affairs of the university forward at a time of change, actually. So it is particularly interesting to be able to interfere at stages of change and to have an impact on outcome which shapes an institution. I found that very fascinating. In terms of the qualities, I think there are different ways of management and leadership. Obviously, medicine's a very hierarchical structure, and that sometimes makes it easy to work with, because once you're embedded in the hierarchy, it's assumed that you know what you're doing. But it's also quite difficult to develop collegiality and people working together, and I think that's probably one of my skills that I think is very important, is communication, working with people and developing them as individuals, and not being afraid to develop people who you think are better than you, because actually that's really important. And they will go on and go out and develop into colleagues and peers, and that's hugely satisfying, actually.
And now, what do you think are your challenges for the future?
I guess there is a challenge as to what to do next. There's always a challenge of what to do next. I am actually developing some interests in global health again, which go back to my time in Tanzania, and I'm developing an international health school and some programs of research in Africa that I think will be perhaps the direction of travel. But alternatively, I owe Cancer Research UK a lot for supporting me over the last many years, and I'm also interested in helping out in the charitable sector. So I think that's probably the areas that I'm going to be most interested in the near future.
Professor Leigh, thank you very much for your time today. It's been most interesting to talk to you.